Hi, I'm Joan Maxwell, and I've been a patient here at John Muir 9 times. I'm here today to talk about bedside reporting. I learned so much about my status, and I realized that the nurses knew so much. I also think the nurses had the perspective of the total care, and I think it helped me focus on getting better, and wanted to share that with all of you. So thank you very much.
Good morning, Joan. I'm going to go home. Heather's going to be your nurse tonight. I'm going to give report to her.
Hi, nice to meet you.
And yeah.
How are you feeling right now?
Pretty good. I think my knee still feels very stiff, but it's definitely better.
Good. That means we're seeing some improvement.
Yes.
I'm going to go ahead and review your goals for the day up here on the whiteboard. So we want to use your incentive spirometer every hour while awake. Okay. We're going to walk 40 feet out in the hallway, and we want to wean you all the way off the oxygen. Do you have any more goals you want to add today?
That sounds good.
Okay. I'm going to go ahead and write my name and direct number on the board here, so you can call me anytime that you need me, okay?
Absolutely. You can press the call light or even use the phone on your bedside table to call the extension. And you just dial the 5 numbers. Okay? Alrighty. Well, this is Josefina Maxwell. She likes to go by Joan. She's status post left total knee arthroplasty. She's post-op day number 1 with Dr. Roberts. Past medical history, diabetes type 2, chronic back pain. Joan is alert and oriented times 3, very pleasant. Her lung sounds are diminished at the basis. She is on 1 liter of oxygen. She was on 3, and so we weaned her down. She's about 96% saturation, so she's doing really well.
Good.
She's using the incentive spirometer, but needs a little bit of encouragement.
Okay.
She go up to about 1,000. Maybe we want to go up a little higher, like 1,500 for tomorrow. Maybe that could be a goal. She has good CMSTs to that lower extremity.
What's CMS?
Oh, CMSTs, it stands for color, movement, sensation, and temperature. And it's something that we assess to see how you're progressing towards healing. So you're doing really well. It's really good. Her mild edema also is improving with elevation on a pillow. She got up twice to the bathroom with 1-person assist.
Good.
And PT worked with you twice, PT and OT, and got her up and ambulated in the hall twice. So maybe tomorrow you can get up 3 times. After activity, we use the polar ice therapy. That works really good to control her pain. We're having a little bit of pain issues and discomfort. We're encouraging the PCA, but we're also giving pain medicine, oral tablets every 4 hours. So she used 2.5 the last shift.
Okay.
And the shift before was 3, so you're using less. So I think the
good.
pain pills are working.
Means you're
That's
improving.
Good. She has a continuous nerve block still too. It's going at 6 milliliters an hour. Diabetes-wise, her last blood sugar at noontime was, what was it? 148, and in the morning was 130, so no insulin.
No coverage.
Yeah. And Dr. Roberts did come today and talked about possible discharge tomorrow. So we have a big day ahead of us tomorrow. And then in conversation during my shift, she said that she takes Ambien for sleep. So that should help her sleep better.
We can definitely do an Ambien before bedtime tonight.
Thank you.
Okay?
Yeah.
So if it's okay with you, we want to just do a quick handoff. We want to look at all of your equipment and your incisions together, if that's okay.
Sure.
So I'm just going to lift up your sheet here so we can take a look. So her bed alarm is on.
Bed alarm is on. SCDs are on.
She's good.
Good. Wiggle your toes for me. Perfect.
Dressing is dry and intact.
Mm-hmm.
And then this on-cue pump is going at 60 cc's an hour.
Dress is
milliliters
clean,
an
dry,
hour.
and intact. Good.
She also has her pain button.
Good. And your IV site looks good.
And then her lines are good for another 24 hours. And then her dilaudid PCA settings are 0.24 and 8.
Okay.
Sign in.
So we're just going to sign in the computer so we can do a double RN verification to make sure all the settings on your PCA match the doctor's orders. Okay. I'm going to scan your wristband. Can you tell me your name and date of birth, please?
Joan Maxwell, 12/3/51.
So I know we used a lot of medical terminology. Do you have any questions?
No, I think sounds good.
Okay. Is there anything else we can get for you before we head out?
I think I'm fine for now. Thanks so much.
Okay, if you need anything, make sure you push the call light or you can call me on my extension up there, okay? We do hourly rounds here, so myself or the CNA will be by at least every hour, just to make sure you don't need anything, any pain medication, you need to get up and use the restroom, be repositioned. But if in between there you need something, feel free to give us a call, okay?
Okay.
Yeah.
Okay. It's a pleasure to meet you. I'll be back in about 15 minutes to do my full head-to-toe assessment on you.
Okay. Thank you.
Awesome, and I wish
Have a
you a
good day.
oh, thank you. I wish you a
Thank you for
speedy
your help.
recovery, and I'll be back tomorrow morning. Okay?
Thanks
All
for
right.
all your help.
Yeah. Take care.
Would you like the door opened or closed?
Open.
Open? Okay.
The purpose of this video is to demonstrate the narration of care that we provide to our patients. What is narrating care? Narrating care is when staff become more verbal with patients and families. It is a change in process rather than walking in a room and providing care, but to explain all of the whats and whys of what is being performed. This provides our patients and families with an increased sense of understanding as well as confidence in the care we are providing through the simple task of sharing our knowledge and expertise of the exceptional care we are providing to our patients. You'll be watching two videos. The first is a poor demonstration of narrating care. The second will be an example of how we should narrate the care we provide to our patients.
Hi,
Hi.
my name's Giselle. I'm going to get your blood sugar. Scan your wristband. Your blood sugar is 155, so we're going to give you some insulin today.
But I'm not diabetic.
Well, the doctor has you getting insulin today, so we're going to give that to you.
Oh, that's weird.
Scan you.
Oh, why are you pulling out my shirt?
Oh, because that's where the insulin goes?
Oh.
Oh, shoot.
By communicating the whats and whys of the care we are providing, patients are well informed and have an overall increase in their satisfaction.
Good morning.
Good morning.
My name's Giselle. I'll be your nurse today. Just getting some gel on my hands. We're going to get gloved up, and then I'm going to check your blood sugar this morning.
Okay,
How are you feeling?
I'm feeling good.
Good. You feeling hungry for breakfast?
Yes, very hungry.
Good. So let's get your sugar checked and see where we're at. And scan you. Can you tell me your name and date of birth?
Sure, Jessica Bermudez, 5/21/1980.
Perfect. Get your finger poked here. There's a gauze. So your sugar's 155, so we're going to give you some insulin this morning.
Oh, I'm not diabetic though.
So after surgery, the doctor likes to keep your sugar under very tight control. It helps promote healing. It helps your incisions heal properly.
Okay.
So that's why we give insulin. Go ahead and scan this. One more time, I'll have you tell me your name and date of birth while I check in the computer.
Jessica Bermudez, 5/21/1980.
Beautiful. And then for insulin, we just do a double check with another nurse. So I'm going to go grab another nurse, bring her back in, and we'll check the insulin together.
Okay.
Okay? I'll be right back.